Many people see it as a cosmetic issue until it starts to hurt, makes it difficult to walk, or it causes restless leg syndrome. Because it can also cause skin discoloration and ulcers, some people might mistake it for a dermatology issue. As our next guest explains, the problem lies beneath. Dr. Rajiv Agarwal with Modern Heart and Vascular Institute joins us with a modern, quick, and comfortable way to treat venous insufficiency or vein disease, and there's no downtime. You can finally be comfortable with the skin you're in. Good morning, Dr. Agarwal.
Good morning, Deborah. How are you doing?
I'm doing well. All right. Vein disease and poor circulation. When the body, it basically has about 60,000 miles of blood vessels, but when there's a kink in that hose somewhere, your body knows it.
Yes, and people get lots of symptoms in their legs and they tend to ignore them. So there are two types of blood vessels in our body. One are arteries and one are veins. The key distinguishing feature, Deborah, is when someone gets symptoms in their legs and it's with walking, it's usually an arterial issue. And as you see on the picture over there, the veins and the valves aren't working. The valves and the veins, sorry, aren't working very well. And that's when you get vein disease. And that's usually in the evening or nighttime. And you get cramps, restless legs, Charlie horses, swelling, just a lot of achiness and discomfort in the legs.
Yeah, the legs are more problematic, partly because it's a bigger body part, right? But it's also further away from the heart.
Yeah, the toes are actually the farthest away from the heart. And if you have circulation problems, you will feel it in the legs and toes. Again, mostly at night if it's more vein disease.
Yeah, and I can't tell you how many people have said to me, well, I went to my dermatologist. We're like, okay, but you're looking at the symptom of the vein disease, not addressing the actual vein disease, which is why it's important to see someone like you, a cardiologist. That's one of the system of the body that you deal with. Let's talk about arteries and poor circulation symptoms.
Yeah, so artery symptoms are usually with walking. So you can get fatigue and tiredness in your legs, sometimes even burning or cramps in the legs, but with walking, that's the distinguishing feature for arteries.
All right, and then for veins.
For veins, it's more at rest, Deborah. If you get cramps, restless legs, swelling, the one thing new that I want to tell the audience is that if you notice any changes in the color of your legs, so look at your legs, and if you see that there's any discoloration, if the pigmentation up top versus what's closer to the ankle is different, if it's darker, it may be your sign that you have very poor circulation.
Yeah, and sometimes we see it, and we say darker, it's almost purple or red and purple mixed together.
Yeah, really any color change. I mean, you look at the thigh area and you look at below the knee, and if there's any changes in the color, be warned, because that may be your only sign that you're seeing that you have early circulation problems that should be addressed now.
Yeah, and also another thing is kind of the scaliness and the swelling. All right, there are risk factors to both. For arterial disease, what are those risk factors?
So for arterial disease, Deborah, it's just the more common ones that we see with even coronary or heart disease. That's diabetes, high blood pressure, high cholesterol, smoking, obesity. And now we definitely want to throw in COVID, because we're seeing younger and younger people who've had COVID that are coming in with bad arterial disease.
All right, and for venous disease, risk factors are?
Vein disease, the most important risk factor is lack of activity. So people that have jobs that gravity is kicking in, like teachers, flight attendants, doctors, nurses, TV hosts. But the key is lack of movement is the key, and obesity, which you're definitely not. So those are the most important risk factors for vein disease.
All right, I'm gonna start doing like lifting weights and exercising while I'm sitting in the chair interviewing people. All right, to diagnose the circulation is fairly easy for you as an expert. So walk us through that part, and then what kinds of things we can do to address, for example, a blockage if there is one.
Yeah, so it's very rewarding, actually. People come in to see us for their leg symptoms, and a lot of times we really don't have to do much testing. The key is just talking to them and listening to them and hearing them out, and usually we can decipher if it's an arterial issue, venous issue, real neuropathy, spine disease, and then a good physical exam looking at their legs, listening to their heart, and then if needed, you do non-invasive, simple, painless ultrasounds that look at the arteries and the veins, and then we have a good talk with our patients and come up with a plan. For arterial disease, the plan may be something simple as just a roto-rooter, outpatient procedure. You come in, we open up a blockage, and you go home. For vein disease, it's done in the office. It's so exciting.
Yeah, which is very different from like maybe the olden days. And so some people might not be coming in because they remember their parents or their grandparents going through a pretty aggressive procedure. And as you just mentioned, don't have to do that now. The venous treatment, for example.
Yeah, the venous treatment is when we're injecting glue directly into the veins. So people always ask me, "Wait, you're injecting glue, you're closing off a vein, isn't that dangerous?" My response is, think about it that you're driving on a 5-lane highway, and 2 of the lanes allow cars to go in both directions in the same lane. All we're doing is closing off those 2 lanes and allowing cars to go into the 3 lanes that are wide open and only allow one-way traffic.
Yeah.
As you can see on the screen, the procedure is very simple. It takes about 4 to 5 minutes, done in the office, pretty much painless. You walk in, we do it, you drive yourself right back home. Very, very comfortable procedure. We've done it on my mom as well, and her symptoms in her legs completely went away afterwards.
Yeah, and this is one of those things that don't put it off because it doesn't get better over time. In fact, it pretty much gets worse over time.
It will get worse. It's like the tread on your tire. The more you use it, it's only going to get worse. So yeah, the sooner it's addressed, the results are just marvelous. I mean, people have come back dancing and they weren't able to walk or sleep before.
Yeah, dancing, walking, and wearing shorts. It's hot outside. All right. Thank you, Dr. Agarwal.
Summertime.
All right. To book an appointment with a board-certified cardiologist at Modern Heart and Vascular Institute, visit them online at modernheartandvascular.com. You can also give them a call, 832-644-8930. Again, that is 832-644-8930. They accept most major insurance, including Medicare. Appointments fill up fast, so contact them today. Modern Heart has locations throughout the greater Houston area, including their newest location in Tomball. By the way, they have doctors who are fluent in Spanish as well.